So many of you have heard of the famous racehorse Seabiscuit, I'm sure. The horse that won the horse that raced 89 times, won 33 of those races, and was top 4 61 times, all while setting 16 records. Well, this incredible athleticism is what sparked my interest in working with the owners, trainers, and veterinarians at the Santa Anita racetrack. Now, starting in 2012, I was a licensed trainer's assistant and veterinary intern there. While working there, though, I was able to see the gore behind the glory. And this included training and racing with hazardous track and health conditions, the condoned use of poorly tested drugs, and the animals being pushed past their natural limits. Now, these factors in the end lead to the deterioration of the horse's health that could result in premature deaths before their normal lifespan of 25 to 28 years old. Even the iconic Seabiscuit died at the age of 14 due to a heart attack. Now, it is my contention that the decisions of owners, trainers, and veterinarians of the thoroughbred race industry have detrimental effects on the health of these horses. Just as a note, from here on out, I will reference the owners, trainers, and veterinarians involved as caregivers, just to shorten the term a little. So, first of all, the decisions of the caregivers of the thoroughbred industry to train or race in hazardous track and health conditions is detrimental and leads to severe bone and ligament problems for the horses. By hazardous track, I mean potholes all over the track, uneven surfaces that cause the horse to land in awkward positions, scattered rocks, or even synthetic track, which is unnatural for the horse to run on because it's rubber and wax combined. As stated in the LA Times, Del Mar Racetrack experienced 4 deaths within 48 hours due to their turf course, and 3 of these deaths were caused by euthanasia after fatal leg injuries on the course. Thurlow McNally, a European Veterinary Council of Ireland, who's a specialist in equine surgery, stated that fractures are 2 times more likely in racehorses, and that deformation of bone occurs under the high-speed exercise on these unnatural surfaces. Now, in terms of the health hazards, the racehorses begin this intense and high-intensity training at the age of 2 years old when they are still growing and the bones are still forming. Now, this results in increased bone mineral density. Now, generally, bone mineral density could be seen as a good thing when it's increased, because that means it's not fragile, it's not porous, and won't break as easily. But in this case, it's the opposite. A 13-week study was done, and the results were published in the Veterinary Journal. Bogers and his colleagues stated that the deposition of new bone within existing high-density bone contributed to a greater bone fraction and therefore more fractures. So this, in a way, is like you getting a major fracture in your leg, and then it just healing over itself. It's just more likely to be damaged again. So this means that osteochondral disease is more common, and so due to the pressure, more damage occurs, and to compensate, the horse's body does what's called stress remodeling, and it's new bone becoming apparent when the old bone is damaged, and therefore this results in a weakened cartilage matrix also, because the bone is forming over the cartilage, and it results in weakened muscles and ligaments. These 2 factors lead to a greater number of fatal distal fractures, which are chondral and breakdown. The support structures of the fedlock, which is basically the lower leg of the horse, give way, resulting in the tearing of suspensory ligaments and the fracturing of the sesamoid bone, which is the equivalent of our ankle bone. But in the horse, it's a little more important because all of their weight is on their ankle bones. So if that gives way, they don't really have anything left. So once the fedlock gives way and the suspensory ligaments are torn, the back of the ankle hits the ground, and that results in the entire ankle bone being shattered, blood flow being disrupted, and no repair. So immediate euthanasia on the track. The second point that I'd like to make is that the caregivers in the thoroughbred race industry practice condone admission of unknown or poorly tested drugs, which leads to negative side effects on the horse's health. Salix and Lasix are legal drugs that claim to reduce or prevent exercise-induced pulmonary hemorrhages by manipulating the blood pressure of the horse at peak times. Now, pulmonary hemorrhages are the blood vessels in the lung bursting and blood going everywhere basically and bleeding out through the nose. Now, this drug is also known to enhance the racehorse's time, so there's controversy over if it's really helpful or not. But in the Journal of Veterinary Pharmacology and Therapeutics, Lawrence Soma and Cornelius Uba stated that the reduction in blood pressure in the lungs caused by Lasix is not sufficient to prevent bleeds. However, it increases urination and results in dehydration and lack of electrolytes, which in turn causes a decrease in calcium and potassium, which are both very vital for the normal functions of the heart and the cardiovascular system. This in turn results in a weakened heart and heart attacks. Joint injections of steroids are pretty common also, and it basically numbs the pain and causes the horse to overuse it, which makes further deterioration of the joint. And the final point is, in all, that these horses are pushed past their normal limits, so extreme physiological stress is caused. There are a total of 247 thoroughbred deaths in 2014 due to fatal injuries or heart attacks or other, as they claim, causes. 13 out of the 16 were fatal injuries, or 16 out of 25 were fatal injuries due to broken legs, and then 5 out of 25 were heart attacks. So it is my contention that the decisions of the owners, trainers, and veterinarians of the thoroughbred racing industry have detrimental effects on the health of the horses involved.
Well, the proposition's identified clearly, and you come back to it at the end of the speech, which is good. I think you need a stronger layout of the contents of the speech at the beginning of the presentation. You do some signposting in the body of the speech, which helps a little bit. On a couple of the points, it really seems like it's expository material where we're getting these explanations about how these injuries occur, and I'm not sure that there's a lot of controversy about those kinds of things. The controversy occurs in whether or not the treatments that encourage this sort of behavior are necessary, whether or not they are done without consideration for the horse's health. That seems to be where your general inference is, and I think we need a little bit more data on that. At the end of the speech, where you have the one statistic about the total number of injuries, I thought that this was the piece of information that I needed to have earlier in the speech, and there is still some stuff missing from it. For example, you mentioned that the 16 out of 25 of the fatalities were due to leg injuries, and 5 out of 25 that they looked at. I don't know why they got 25, because you've got 247 that you mentioned. Is that a particular track? That wasn't clear. Anyway, on those particular statistics, the question then becomes, and is there data that shows that those horses were given the drugs that you're talking about, that they were subjected to the training, and therefore they were more likely to get those kinds of things? That seems to be the thing that would kind of nail this argument a little bit more and make it clearer. You know, like I said, from the point of view of I'm just thinking about the position of the person who's responding to this. I don't think anybody doubts that thoroughbred horses are going to be stressed more, that they work harder, that they have, you know, a vigorous and tough job to do in their life and that sort of thing. So there are going to be consequences. The question is, are those consequences undue? Are they unreasonable for us to, you know, for the trainers and the owners to be taking? You know, and we need that kind of comparative data that goes on. Like I said, I just felt like sometimes you got sidetracked into the discussion of the medical condition without explaining what the source of that condition was, and that's where your argument is whether or not that source is necessary or not for the safety of the horses. All right, thank you.